Okay, so starting.
Yes.
What is, in your opinion, the highlights of attending ICUH, and how does this conference differ from other international conferences?
Well, for me, this is a very unique global conference, and I go to many conferences around the world. This is a very special conference, and this is my third year in a row attending. I was at the Dhaka conference, the San Francisco conference, and this conference. And I represent a group of professionals who manage our cities. The International City Management Association is a professional association of city managers. And in this forum, we have several hundred health professionals who really understand the dynamics of working in an urban location and how that differs from working perhaps in rural environments. And they understand the importance of good governance in the city. So they appreciate the role of the city manager, and the city manager appreciates the role of the public health professional. And the way to achieve our common shared vision of a healthy city is to work closely together. Health professionals need to inform all departments of the city, and city managers need to solicit the input and the information and the data that health professionals can provide to help achieve this goal of thriving, healthy cities.
What do you think are the most critical health challenges that cities face nowadays?
Well, I think we're seeing in cities across the globe that new diseases are emerging. They're referred to as the non-communicable diseases. I think historically, international donors and public health professionals have been focused on the infectious diseases, as rightly they need to. There have been a lot of achievements in malaria, HIV/AIDS, tuberculosis, etc. But what we're seeing now, as more and more people, in fact, the majority of the people on the planet are living in cities, are the non-communicable diseases like obesity, blood pressure, etc. So these are urban manifestations of disease, and I think public health officials are focusing now on these as well as continuing their efforts on infectious diseases, and they're understanding that all departments of the city, parks and recreation, transportation, all community development, all can address what's known as the determinants of health, the factors, the economic and sociological factors that determine health, and where we can have interventions designed, as I said earlier, together to really have a positive result on the health of the city.
Finally, what are the opportunities that are evolving that you think are the most important for the good governance of cities?
I think the opportunities that are emerging are the recognition of the importance of professional city management, good governance, and good ethics in city management. And cities are increasingly complex corporations. They need to be run like big international corporations, and cities do have transnational interactions. To be a competitive city, one has to look beyond not only one's city limits, but beyond one's nation's borders to be competitive in an economic development sense. So I think the recognition of professionalism, the need for skilled leadership to manage cities is very important, and the reverse, that city leaders need to bring all stakeholders to the table, including and especially health professionals, but others, all members of the community, to really engage their residents in order to achieve, the goal of a thriving city.